I need the Dr. Eng to let me share the screen.
Oh, yes, sorry.
Okay. So thank you all for all your indulgences. I do apologize for the kerfuffle here.
No problem.
And those of you who've heard me before, you know that I'm the hormone guy. And everything that we do in our practice deals with hormones, and we do everything through a hormone-centric lens. But today, I'm stepping out of my comfort zone. I'm not going to pretend that I'm a homeopath. I'm not going to pretend that I'm an expert at it. But we're going to talk about introduction to hormone optimization, the homeopathic version. I'm not going to talk about how we're going to treat anybody with hormones, prescription medications, or even herbal remedies. It's strictly homeopathic remedies. So Dr. Zarin, if I get anything wrong, I want you to correct me. And I'm going to do the best I can here. I really like to call these talks nearly everything we learned about, fill in the blank. Today it's going to be hormones, but nearly everything we learned about hormones in medical school was wrong. We give talks specifically on specific hormones, estrogen, testosterone, thyroid, and every one of those talks, I always use this as a subcategory. Nearly everything we learned about testosterone was wrong, estrogen was wrong, thyroid was wrong. It's really poorly understood. This was a CME class, so I have no financial things to work about. We'll talk a little bit, just shortly, about a little bit why talk about hormones, why hormone optimization. I'm not going to go too much into the myths because I want to talk about how we're going to balance things with our homeopathic remedies. But why look at hormones? Hormones are messengers. They carry messages from the organs of origin to the end organ cells. Hormones regulate everything: hunger, emotions, energy, how long you sleep, how well you feel, how badly you feel, and how well you sort of mix in life. Hormones are the juice of life. And I like to say that a body depleted of hormones is like the caterer not showing up at the wedding. You can probably get by, but you're going to do a lot better if they had shown up. We look at, there's 36 hormones in the body that are significant. We only look at 10 of them. In the US, there's some of them that we're sort of restricted at, and so there's really no point in looking at them. But the main hormones, there's 10 of them that we look at, 7 that I call major ones: testosterone, estrogen, and there's 3 types of estrogen: progesterone, growth hormone, thyroid, cortisol, insulin. And 3 minor ones: DHEA and pregnenolone, and prolactin. Although we're going to see that all of them have some sort of importance. Hormones. So hormones are usually associated, at least in our mind, with aging. And whoever put us together millions of years ago really played a cruel trick on us. Our hormones levels peak at ages 25 to 27, and they start to dissipate. And usually by the time you get to 50, remember 100 years ago when you got to 50, or depending on hygiene and things like that, when you got to 50, you were old. I have a picture of my grandfather who passed away before I was born. He looked like he was about 90 years old. He'd had 7 heart attacks from what I had heard. He had blood clots in his veins. He had, I think, liver cancer. And he looked like he was 53 when he passed away, and he looked like he was 90. My grandmother, who was still alive when I was young, also, she was old. She was an old lady. She passed away at 63. And the hormones depletions affect everything: your skin, your hair, your nails. And if you know what to look for, you can actually look at somebody as soon as a patient sits down, and there's certain characteristics that I can tell which hormones that they have too much of or too little of. Hormone optimization makes the fall graceful and with ease. This little chart here shows you how the hormones sort of dissipate as time goes on. And as you can see here, estrogen really falls off in the 40s and 50s. And unfortunately, it's falling off in younger and younger. And I've had patients as young as 32 in full-blown menopause. And I have other patients in their 60s that still have a full ovarian function. So it's really individualized. For men here, especially, you can see testosterone it does fall off also, but it's a more gradual fall off. So, we don't get the grumpy old man till late 50s, early 60s. So I like using polycystic ovary syndrome as an example of what happens when hormones sort of get out of balance and get fit. So polycystic ovary syndrome is defined as oligo or amenorrhea, which means little or no menstrual cycle, excess androgen, too much androgen, and cysts on the ovaries. And you need 8, depending on who you read, 8 to 12 cysts on the ovaries. So 1 or 2 doesn't count. If you do an ultrasound, it's described as it's like a string of pearls. So polycystic ovary syndrome needs 2 of those 3 symptoms. And what goes along with too much testosterone aromatizes or breaks down into estrogen. So you end up with an estrogen excess. Too much estrogen causes cysts. Breast cysts, uterine cysts, which we call fibroids, ovarian cysts, which are ovaries, endometriosis, which are cysts on the ovaries, cysts on the endometrial, the uterine lining, and surprisingly, gallstones. They're all interrelated. So it's not unusual for a young lady to show up in our office in, say, age 40-ish or so. She has fibrocystic breast disease, spotting in between periods. She had her gallbladder out 10 years earlier, and she has an ovarian cyst. And when we do a mammogram, and I'll tell them ahead of time, did you have a mammogram? If they tell me yes, I said, let me tell you what it says, and it'll say dense breasts. It's a pattern. We see it over and over again, and it goes along with it. If I can tell them what their mammogram looks like, 30 seconds after they sit down and start telling me what their issues are, we really build credibility, I think. And also what goes along with it is insulin resistance or blood sugar abnormalities. So polycystic ovary syndrome is 3 things, 2 of 3 things. It could be cysts on the ovaries, and remember, it has to be anywhere from at least 8 to 12. It has to be high androgens, high testosterone, high androstenedione, and high and blood sugar abnormalities. So you need 2 of those. So you can have normal ovaries, high blood sugar or blood sugar abnormalities. It could be low blood sugar also, and testosterone abnormalities, and just have those 2, and it's polycystic ovary syndrome. 4 to 10% of U.S. women have polycystic ovary syndrome. It accounts for 75% of the women with amenorrhea. It accounts for 85% of the women with androgen excess and hirsutism, too much hair. We get an increase in one of the ovarian functions, LH, and a decrease in FSH. That causes testosterone to be produced in excess, and you get that secondary breakdown of estradiol. And again, I just told you this, you get 2 or 3, you need 2 or 3 of those categories. You get a hip to waist ratio of greater than 0.85. You get obesity, oily skin, acne. You can have hair loss, hypoglycemia, high blood pressure, depression, irritability. And so those of you that are homeopaths or even the aromatherapy people, you start thinking about the remedies that you might apply for this type of patient. Acanthosis nigrans, which is darkening of the skin, usually around the neck, but it can be any of the joints actually, and infertility. Polycystic ovaries results in all of these as one type of syndrome. High insulin, blood sugar abnormalities, lipid abnormalities, too much fat, overweight, central fat, high blood pressure, and you can get coronary artery disease. So these are the remedies that I've come up with for polycystic ovaries. And so what I did was I searched The symptoms, I didn't put in, say, testosterone or testosterone excess, but the symptoms, and these are the remedies that I came up with. So DEETS means details, and then I have the dose here. So sepia as irregular or scanty menstrual cycles, so there's your amenorrhea, and for cases where periods are late or not heavy, abnormal hair growth, and especially hair on the face. That is a testosterone excess. Pulsatia is oligomenorrhea, painful periods, and it suppresses irregular periods. That's a progesterone deficiency. Calcarea, carbonate, prolonged heavy menses, weight gain, obesity due to polycystic ovaries. So those are testosterone and estrogen issues. Reduces excess weight, excessive head sweating, and cold sensitivity. And cold sensitivity is sometimes dealing with thyroid issues also. And I have the doses here also. Natrum mur is irregular or suppressed menstrual cycles. It will regulate them, and we can use that in infertility. And thuja, which we use for quite extensively for vaccine reactions, and even vaccine prevention of reactions, can manage excessive hair growth. Again, excessive hair growth is a high testosterone. The brownish skin pigmentation, remember I mentioned that acanthosis nigra, that's insulin resistance. And then there are the doses there. So the benefits of hormone optimization for men: enhanced energy, improved exercise tolerance, and this is actually for females also, better sleep, memory, concentration, starting projects, finishing projects, strengthening bones, it improves lipid levels, and it protects against heart disease. In females specifically, it reduces night sweats, hot flashes, painful itching, intercourse, vaginal dryness. It will improve energy levels, fat loss acceleration, sexual energy, memory, concentration. It will smooth wrinkles. So anybody who does any nursing home work, if you go into the lunchroom in a nursing home where there's a lot of elderly people, the women that are sitting up and have nice smooth skin and they're playing canasta and they're having a great life in their 80s and 90s, those are the ones who had hormones. The ones that are slumped over and their skin's all wrinkled up and they're barely moving, those are the ones that didn't. The risk of heart disease in females is decreased by up to 50% with adequate hormone levels. So general remedies, this is just general for men's health. I have Cali-Phos, and this is for mental fatigue, nervousness, irritability, energy enhancement, improved concentration and memory. Those are the characteristics of testosterone deficiency and growth hormone deficiency. It also uses a nerve tonic and for physical exhaustion, what we call, that's our HPA axis. I know that was mentioned earlier. Like copodium. Again, I'm still new at this, Dr. Zarin, so don't throw too many tomatoes at me. Cognitive issues, digestive disorders, reproductive health disorders, memory, and cognition. It's indicated for bloating and gas, and for digestive discomfort and mental and emotional strain. Phosphoric acid is suitable for physical and mental exhaustion. This is your cortisol abnormalities, cortisone abnormalities, memory issues, and overall weakness. It's known for effectiveness in overwhelmed individuals, leading to debility. Gelsemium is effective for dizziness, headaches, and confusion, used for nervous anxiety and tension, leading to physical symptoms. Conium is useful for age-related issues, particularly muscle tone and strength. It's indicated for physical weakness, dizziness, and coordination. Argentium is useful for anxiety and impulse behavior and mood disturbances. Again, low testosterone. Calcarea phos is known for treating bone weakness. So this is osteoporosis. And men can end up with estrogen deficiencies also, especially that's what we doctors do when we treat them with testosterone and give them estrogen blockers. They end up with osteoporosis. For females, again, sepia, we mentioned that earlier, effective for menopausal symptoms like hot flashes and vaginal dryness, mood-related disorders, and improved energy levels. Lechesis is often used for menopausal symptoms, hot flashes, night sweats, that's estrogen deficiency. Ignatia addresses emotional fluctuations, mood swings and anxiety, and intense emotional times. Pulsatia, again, is suitable for irregular menses and emotional changes. Black cohosh is used for menstrual abnormalities. Calcarea carb for bone health again and prevents osteoporosis. Phosphorus supports energy levels and it stimulates scalp hair growth. Hair growth in the hormone world deals with too much or too little of testosterone, estrogen, and or thyroid issues. Salacia is for beneficial skin health, hair growth, and strengthening nails. It promotes connective tissue. And so those are just some general ways to take a look at things. And next, anybody have any questions? Again, we mentioned the 10 major hormones, seven primary and 3 secondary. And we're going to take and this is sort of the way the hormone world works. And so it all comes from cholesterol. So everybody's taking cholesterol pills. If you look at the side effects from your cholesterol pill collection, you know, that paper they give you, that's as long as your arm and leg together. If you know what to look for, you look at the symptom clusters of what happens when you have side effects from the cholesterol, it's actually hormone deficiencies. So these are the symptoms that we look for with each individual hormone. So for testosterone deficiency, it's anxiety, depression, poor sense of well-being, muscle tone, poor muscle tone, urinary incontinence, vaginal dryness for females, erectile dysfunction for males, poor libido, poor sexual function. Too much testosterone, we already talked about that a little bit with the polycystic ovaries, oily skin, oily hair, acne, skin breakouts, particularly on the necks and shoulders. The books always mention road rage. I quite frankly have not really seen a whole lot of this. And I've been treating patients with testosterone for 20 plus years. We see it very rarely. Higher blood pressures, long-term, you can get atherosclerotic vascular disease if the testosterone levels are extremely high for long periods of time, and acne. Thyroid, dry skin, dry hair, fingernails crack and break, constipation, can't lose weight, cold all the time, tired all day long. So we can take these symptoms and we can match them with our remedies. Estrogen, hot flashes, night sweats, brain fog, belly fat, too much estrogen, we already talked about that. Progesterone is agitated, irritable, can't sleep, poor libido, headaches, short-tempered. Cortisol is tired when you rise. You need something to keep you going in the morning. In the afternoon, you need a nap. By dinner time, you're exhausted. Later at night, you get a second wind, and that's why you're wide awake. Basically, your nights and days are upside down. There's usually sugars and salt cravings. Growth hormone deals with executive function. I heard somebody mention that earlier. Executive function is memory, concentration, the ability to start projects, finish projects, or do multitask easily or not. The ability to complete tasks, paranoias, dark moods, obsessive compulsive tendencies. That's growth hormone deficiency. Insulin too much, you know, is diabetes. So excess thirst, urination, abdominal pain. Not enough is sweating, tired, hunger. You need to eat every 2 hours. DHEA is sort of like testosterone. Pregnenolone is your hormone of memory. Low prolactin, we see this in treatment-resistant anxiety and depression. These are our folks who have, this is our head injury people. And high prolactin levels, those have pituitary adenomas. So how am I doing on time, Dr. Zarin? So
Dr. Rosenberg.
Dr. Rosenberg, how am I doing on time?
Oh, I think he's on.
We're okay? We're doing good?
I think you have time. You still have time, a few minutes.
Okay. So for testosterone, again, we went through the symptoms. Not enough testosterone. We're going to look at that. You know, those are men younger and younger. I had a young man in my office a couple of weeks ago, age 23. His testosterone level was very low, and he was all symptomatic. He was a gamer. He weighed 375 pounds. I didn't even know what a gamer was, you know, because I'm old. He had to explain to me what that was. But he plays video games for a living. 12 hours a day. He doesn't go out. He doesn't move. So testosterone levels are inversely related to depressive symptoms, inversely related to blood sugar abnormalities, fatigue, suicide ideation, loss of muscle mass, loss of coordination, loss of confidence, and mental fatigue, lack of sex drive. So homeopathic remedies to raise testosterone levels. So califos and avena sativa, low testosterone levels, again, present with marked fatigue, low energy, depression, and poor concentration. And Caliphos is indicated for mental dullness. Venus sativa enhances energy levels, especially in cases of intense disability. Nefer luteum is for sexual dysfunction, for low libido. It restores energy and improves muscle mass. Sabal cerulata, sorry, that's actually saw palmetto. That's for benign prostatic hypertrophy, testicular atrophy, and libido. It's a 5-alpha reductase inhibitor. It theoretically can help you regrow your hair and shrink your prostate. Selenium is for fatigue, erectile dysfunction. It improves sexual function when desire is present, but the drive or the work is not. Depression, weakness, and fatigue. So you can see what we've done is we've taken the remedies and matched them to the symptoms. Acid phos and selenium. Acid phos is for urinary incontinence, hair loss, and depression. Selenium is for hair growth, hair loss, and patches. That's alopecia areata. That's usually an autoimmune type issue. Agnus cast and Agnus castus, reducing sexual desire, melancholy, premature aging, erectile dysfunction, and low libido. Argentium is for anxiety, erectile dysfunction, specific food cravings, and dysbiosis, stomach disorders. Venus sativa, we already talked about that. It improves energy and poor concentration. And Stafford's Geria is for depression and poor muscle tone. So again, these are all the symptoms of low testosterone. Barytia carbonica, age-related changes due to low testosterone, impotence, and reduced libido. Caladium is for irritability, depression, sexual exhaustion, erectile dysfunction. That's your grumpy old man. And chase tree is good for memory loss and poor concentration. Too much testosterone. Again, we talked about that with the polycystic ovaries. We went through all of these. One we didn't talk about was nux vomica, which is good for skin problems exacerbated by overindulgence in certain foods and drinks, road rage, and irritability. The other ones we did talk about, and we didn't talk about apis, which treats swelling, particularly with stinging pain. Natarum murata is good for oily skin, oily hair, acne, and back pain while lying on a hard surface. I got some of these from the Materia Medica. There's some flowery language in there. Platina is for hypersexuality in females, the femme fatale, and paradoxical moods. And again, selenium is increased desire for sex, but an inability to perform. Testosterone controversy. So, when we treat patients with testosterone, certain things happen, and these are the ones that are the most problematic. Mostly gynecomastia and erythrocytosis. So gynecomastia is breast enlargement. Erythrocytosis is increased red blood cell count. We really want that. That's how you get your energy and your strength from testosterone. Adequate testosterone. It increases red blood cell count, which increases your hemoglobin, which is your oxygen carrying capacity. It can get too high, and it's been confused with something called polycythemia vera, which is a blood tumor. It's actually a rare blood tumor, but every doctor knows about polycythemia vera and testosterone, which is not true. So testosterone increases red blood cell count, and it increases something called erythropoietin, which is the hormone produced in the kidney that increases the red blood cells. Polycythemia vera is a blood tumor. It's actually a genetic tumor. They're JAK2, JAK1 gene, and TET2 genes are positive in polycythemia vera. They're negative with erythrocytosis. But an easy way to look at it is just look at a CBC, a regular blood count. You not only get an increase in red blood cells, but you get an increase in white blood cells. That has to be over 14,000. You get an increase in platelets. It has to be over 500,000, and also alkaline phosphatase in a blood test. So there were myths that were about prostate cancer and testosterone for more than 60 years before they got debunked. And the myths are that testosterone causes prostate cancer. It does not. It doesn't increase the risk of it. It doesn't increase the progression of it. And if your patient has metastatic prostate cancer, it does not increase progression and death. How to use homeopathic remedies with prostate issues. We like Thuja for benign prostatic hypertrophy with outlet obstruction. Sabo cerulata, which is your saw palmetto. We talked about that one. And conium is for more elderly patients with urinary issues such as difficulty starting a stream and stopping in a stream. And it also with slower sexual excess or desire. Baradia is for, again, benign prostatic hypertrophy. There's a typo there. Chimalphia is for urinary retention. I hope I'm pronouncing these right, Dr. Zarin. And feeling like a ball in the perineum, so a ball down, down between the sexual organs and the rectal area. You need to strain before you flow. Staphysaria, again, is urinary problems after surgery or procedures on the prostate. Lycopodium, bladder issues such as feeling full but producing a slow stream. So these are all issues that develop with prostatic hypertrophy. Erythrocytosis, which we talked about. So it was felt that high testosterone levels cause blood tumors, strokes, heart attacks, venous thrombosis. These have been all debunked. Those are the references for them. That's not the topic for today. Erythrocytosis, to treat this, ferrum metallicum will treat excess blood cells and blood viscosity. Creticus for circulatory disorders and heart issues. Ceolanthus for spleen-related disorders and blood disorders. I know I'm not pronouncing them all right. Sekiel for circulatory issues. Arnica, that one I know, blood and circulatory related problems, and phosphorus, blood health and overproduction of hyperviscosity of blood. Estrogen. So estrogen, is the prime female hormone. It has over 400 functions. And, it got bad-mouthed in studies that were actually poorly done and poorly interpreted. So it increases metabolic rate. It has increases insulin sensitivity. It increases blood flow to the brain. So early on, when we first started treating men with testosterone and their estrogen levels would go high, we would give them estrogen blockers to get the estrogens down to 0. And they were falling over. They were forgetting things. They're putting the car keys in the freezer. I live out in Nevada. They were driving out in the desert and calling me that they didn't know how to remember how they got there, and they were 2 hours out in the desert. So we quickly realized that really wasn't the way to go. It decreases the accumulation of plaque in arteries, and it maintains a skin collagen. It decreases blood pressure. It decreases bad cholesterol. It improves memory. It reduces the overall risk of heart disease by 40 to 50%. It improves mood and concentration. Again, 400 functions. It aids in the formation of neurotransmitters, such as serotonin, which has something to do with depression. And indeed, a lot of the medications that are made for schizophrenia and severe psychiatric diseases are estrogen-like derivatives. Again, we already talked about not enough estrogen, hot flashes, night sweats, brain fog, belly fat, vaginal dryness, poor memory. Too much estrogen, again, are cysts. That's all you have to remember, are cysts. Again, the elephant in the room is cancer. Remember, we were using Premarin, which was a horse urine-related cancer or horse-related preparation. And this is a drug. This is normal. This is a human estrogen. This is, as you can see, you don't have to be a chemist to see that they're different. This is a drug. This is a hormone. Estrogens, were found to cause blood clots and heart attacks, strokes in females, breast cancer, and vascular inflammation. The natural estrogens don't do that. It just lowers risk of breast cancer in treated patients. So this here was that study, that one that scared everybody to death. This is patients with no hormones at all. This is patients that are just taking testosterone or have adequate testosterone. You see they have less breast cancer than if we gave them nothing. So women need some testosterone. To restore estrogen balance, sulfuric acid is good for menstrual symptoms, hot flashes with trembling and a general feeling of weakness, and a sense of urgency in completing tasks. Calcareum carbonica, overweight individuals with hot flashes, night sweats, particularly during sleep, sweats easily from minor exertion, and they have loose, flabby muscles. Sanguinea is indicated for hot flashes with burning in the face, and severe headaches with nausea during menstrual cycle or during menopause, redness in the face, and hot hands. And our patients, if you deal with some of these folks, or even if your family members, all of a sudden they'll start sweating. So here are the remedies for it. Pulsatio, again, hot flashes followed by chilliness. Feels worse in a warm environment or a closed room. Diminishes profuse night sweats, mood swings, and a tendency to cry easily. That's the classic low estrogen. Lachesis is good for hot flashes, particularly in the lower part of the body. It worsens before sleep, the hot flashes, or upon wakening. Belladonna is good for agitation, restlessness, anxiety, and palpitations. Estrogen excess, again, we already talked about some of these. Sepia is good for PMS, menopausal symptoms, irritability, mood swings. Ignatia is good for mood swings, emotional imbalances, and depression. Conium is for breast pain, swelling, and tenderness. A little tip, so symptoms, if the symptoms are the week before the period, if the patient's still having cycles, that's a progesterone issue. So we want to look at the progesterone remedies. If it's during the menses, that's an estrogen issue. So we're going to look at the estrogen remedies. Lachesis, we already talked about. Abnormal uterine bleeding, spotting, hot flashes. Pulsatio is for menstrual problems, emotional sensitivity, and menopausal hot flashes. And folliculium is for PMS and mood swings. I'm going to do progesterone, and then how am I doing on time again, Dr. Rosenberg?
I think
So-
you're almost
We're almost done. So let's get through progesterone, and then I'll take some, and then we'll come back for part 2 if you like this next time. Okay. So progesterone balances estrogen. That's why we need to get through that. It improves sleep. It's a calmer. It's a calming effect. It's the first hormone that starts to dissipate when the menstrual cycle starts to go away. This is the first item in the perimenopausal area. And so the patients end up with agitation, irritability. They can't sleep, poor libido. They want to kick their kids. They hate their husband. Their doctors give them Prozac, and they give them Valium and Xanax. And God didn't make a Prozac or a Valium deficiency. But progesterone, yes. And 4 weeks of an adequate progesterone level, and you'll see those symptoms go away. So you can get over-the-counter progesterone pretty much in the U.S. anyway, any drugstore, any supermarket. You can get a 2%. I've seen it online as high as 7.5%. Usually the therapeutic doses, you need at least 100 milligrams. So 7.5% is 75 milligrams. You can always double up on it. Low progesterone is speculated to be the cause of the breast cancers. So these were 722 patients, 33-year follow-up. That's a long time. They had infertility in the luteal phase, which is the second half of their cycle, with progesterone deficiency. They had 10 times increased death from all cancers, 5.5 times increased breast cancer rate from premenopausal breast cancer with low progesterone. Again, progesterone symptoms: agitated, irritable, can't sleep, poor libido, headaches, short-tempered. Usually we don't see progesterone excess unless we're giving patients too much progesterone versus estrogen. Too much progesterone, they're going to feel drunk or hungover, overly sedated. They'll have water retention, and they can get depression, and they can get some blood sugar abnormalities. There's again another myth that patients who've had hysterectomies, since they can't have babies anymore, don't need progesterone. And true confession, I was an OBGYN resident back in the early 80s, and this is what we did. We would do our hysterectomies. We would tell the patients they didn't need progesterone anymore, and then we would give them Premarin, which was the synthetic estrogen. And I remember when I was a first-year resident saying to a senior resident, these patients come back in 2 years with breast cancer, half of them, and they just shrugged their shoulders. So then 20 years later, it took 20 years for the WHI to figure it out, but they didn't figure out it was synthetic estrogens. They just decided it was all estrogens. So the one reason not to use progesterone is because the patients can't get pregnant anymore. This is after hysterectomy. These are all the reasons to use them. Again, here are the remedies for progesterone deficiency. Sepia, again, Pulsatio, Vitex agnus, which is chase tree. You can get this as an herbal remedy and for most U.S. Pharmacies. It's over the counter. It's not really a homeopathic remedy. You can get it in a tincture form, and this is good for menopausal symptoms: hot flashes, night sweats, brain fog, that kind of thing. Camellia addresses irritability, restlessness, and oversensitivity. Again, lechisis includes suspicion, jealousy, extreme sensitivity. Nux vomica for irritability, impatience, mood swings. Lycopodium is for irritability, feeling angry again, agitated, irritable, can't sleep. Can't see this one here, so let's get rid of that. Rage again for staphyseria. After suppressing anger for a long time, extreme sensitivity to others, lack of confidence. It tends to worsen when excited. That's the same slide. Okay, looks like we're stuck here. Okay, so we did testosterone, estrogen, and progesterone. So if I'm fortunate enough to be invited back, I'll do part 2 next time, and we'll start at growth hormone.
You can join tomorrow, Dr. Clearfield, if you want. You can join tomorrow.
If you give me a time, and I'll be happy to do it.
So yeah, definitely, we're going to send you a time.
Okay. So I want to first of all, I want to thank you all for this opportunity. It's really been great. I'm sorry about the little background issues here. This is new to me, so if I pronounce some of the remedies wrong, I apologize. As Dr. Zarin knows, I'm studying for my homeopathic in Nevada here. You can get a homeopathic medical doctor license, so I'm studying for that now. So this is new for me. This was actually a good opportunity for me to sort of take, the thing that I do that I love and marry it to the homeopathic remedies. And just as a little heads up, I'm going to move on because some of you may not know that I'm actually an acupuncturist also for 30 years. And so we're going to take a look at the acupuncture remedies treatments to go with it also. And I do Japanese acupuncture. So anybody have any questions? I hope that was helpful. I don't see.
Thank you. Excellent. So I don't know, Dr. Rosenberg, do we have time, or we gonna, if Dr. Deerfield can come back for discussion at the end of, because we have 2 more presenters to go, and we can come back for the discussion. So since you brought homeopathy into your talk this time, so a lot of things to discuss. Actually, it's completely different view than my view. So there is no, kind of discussion on that, because it's your medical view on that, on homeopathy. So,
well, like I said, this is new to me, the homeopathic things, but I really like it a lot. I have a few more ways I want to sort of massage it so that I have all the symptoms with the remedies. So I know there was a lot there, and it was kind of jumbled and hard to follow. So
this is a little bit of a form of allopathic bridge that you go with keynote prescribing towards pathology.
Well, that's the way I was raised. I can't help it.
Yes, that's what I'm saying. So no, when you come into homeopathy department, bioquantum, we're going to transform you.
Yeah.
But it's a great knowledge you have. It's amazing knowledge you already have, especially about, the polycrest remedies, such as, like he says, sepia, calcareous, carbonica, and lycopodium, and all those things. These are the major polycrest.
So let me know. Send me in the chat or something if I got anything wrong. Got any of them wrong?
No. You didn't get anything. No. I'm not saying you got anything wrong. But your approach is a medical approach, means is a completely different view than classical approach.
Well, I'm
trying to say it's a keynote prescribing towards the pathology, which we don't do that. We do the totality of symptoms, no matter what. Lechisis could be for a man, you extracted it for a female because it has a picture of female. But I personally prescribed it for so many different men that they have lump in their throat, So
we didn't get to the lumps in the throat yet. That's further on down the road here.
Yes, but no, that was amazing that you extracted a lot of great points. Different remedies you extracted from like Halifax, yeah,
Lei
like
dice
from
stupendo, meraviglioso.
yeah, and but a lot to say about. Thank you. So
Okay,
we
All
have
right.
work to
Thank you
do,
very
Dr.
much.
Clearfield. Lots of
thank
work.
you.
Fantastic.
Thank you. I appreciate it. It was excellent.
Thank you so much.
Thank you.
Ciao,
Awesome.
ciao.
I think the next should go immediately because it's getting a little bit tight here.
Yes, the next presentation will be from Dr. Bridget Goodwin, the president of Australian Apitherapy Association, my postdoctoral student, and please, Bridget, to share the screen. Share screen.
Dr. Rosenberg,
Or you want to present live?
I would prefer if I sent in the video for you, and I'm very happy to introduce it. But could you play it from your computer, because I haven't got it queued up?
Yes,
I'm so sorry.
I will try. I will try.
Thank you so much. Thank you so much to Bioquantum Academy, to Dr. Zarin, Dr. Rosenberg, everyone here. It's an honor once again to be with you all. Most of you know that I spent some time studying with Dr. Rosenberg and did my postdoctoral diploma in treating cancer with bee venom and photodynamic therapy. And I'm about to go to China for the third time in a year because of my fascination with these things. It turns out that in China, bee venom is used regularly in the hospital as one of the medical treatments that is available to everyone. And I was fortunate to have terrific access and filmed a lot in the hospitals when I was training there last year, and I hope to do more when I go back. But what I'm talking about today is the problem of arthritis, as most of you know, is a huge problem. And it's fascinating to look at how the options for treatment are very limited and often, in the allopathic sense, quite toxic. So as most of you know, apitherapy is not strictly legal in many countries of the world. However, many of you are from countries where it's probably completely acceptable. And in Australia, of course, the internet is a wonderful thing, and people are finding out for themselves about the power of bee venom, particularly in the treatment of arthritis. It's very good for many things, but arthritis is particularly effective. So in my role as president of the Australian Apitherapy Association, because it's not recognised here, all I can really do is raise awareness about its power. So when people in Australia have effectively started treating themselves, I've asked them to submit their description to me about their results. And often what struck me was that they're so very passionate about the outcomes that they, in some cases, spontaneously made a video testimonial and sent it to me. And when Dr. Rosenberg asked me to present on treating natural medicine for chronic disease, it struck me that this was a great subject. And because I have all this beautiful footage from working in the Chinese hospitals, I wanted to show how it's so normalized in the Chinese medical system, 4,000 years old. So I'll let you play the video now, and I'll stop talking. Thank you so much.
Thank you, Dr. Bridget.
Thank you. I start the video. One moment, please.
Dr. Rosenberg, could you please tell Dr. Clearfield to stop recording? Because I allowed him to record for his presentation, but it's still recording, and I cannot record for Dr. Bridget.